Good evening, everybody. My name is Dr. Chanel James. I'm the owner of Limbs and Things, mobile physical therapy practice and telehealth practice in Washington, D.C., Maryland, and Virginia. We started PullUp with Limbs and Things to help to clarify any questions you may have regarding education on physical therapy or any of the topics that we bring forth, to challenge some of your thinking, and then to confirm some of the things that you're doing right. So I have some patients that have, usually they give me a past medical history, right? And then they'll give their medication list as well. And then some of the time, people do not necessarily say all of their past medical history, right? So I'm looking at their medication list and then I'm comparing it just to see if we have everything adding up. So in physical therapy school, we go through a course on pharmacology, and you have to know all of the ins and outs of drugs, but then knowing from the aspect of how exercise affects those drugs in the person's body. So tonight, we have Dr. Harrison Beasley. He is a 2009 graduate of Alabama State University and a 2016 graduate of Florida A&M University with his Doctor of Pharmacy degree. He is currently in Atlanta, Georgia, serving the South Cobb County area with CVS Health. And we also went to Alabama State together. So tonight, we're going to talk about pharmacology and pharmacy from his perspective. So we invite you to ask questions at the end. All right, Dr. Beasley, what do you want to share with us tonight?
Well, I first want to say thank you for having me
Sure.
for this platform. It's very, very much needed. And so I just have just a couple of points. And of course, like I said, we're very open to questions that you may have questions that, older family members may have. So the first point that I thought was probably really important is just touching on the intentionality of your doctor and pharmacy visits. Because I know, like, especially with older adults, doctor's visits usually become like your part of your weekly schedule. Going from like your primary care physician to any specialist that you, or like I said, your family members may see. So it can become kind of cumbersome. So they're just very, certain things that I think you should do. First, like Dr. James said, compiling a medication list is one of the most important things from my perspective. I think is needed for older adults because the number of medications that a lot of them are taking gets also to be cumbersome. So keeping a list and an updated list of all the medications that you or family members or friends are taking helps to kind of alleviate some of those issues. Where you have the mishap between your past medical history and then the medication that you take. So medication lists are extremely important to always keep with you because even if you have like a medical emergency, if you have that medication list on you, paramedics, EMTs, doctors that you may encounter will already know the medications that you have. And, you kind of save that time for when they have to call the pharmacy and figure out what you're taking, when the last time you filled it. They already have that information.
Right. So what about, I'm sorry, I wanted to ask you because you have some people that like to bring all of their medications in a bag and they'll present them to you, right? But it's better to have that list than the actual bottle, right?
I think it's better to have the list because it takes up less space, of course, than to bring that shopping bag full of pill bottles.
Right.
That way, you still have the information, what you're taking, what doses you're taking, even if you can list how you take the medication, the time of day or the number of times a day that you're taking it, so that you'll always have that information anytime you're seeing a doctor or a new doctor and they want to know that information. That's, like I said, very important to have that information on hand so that there's nothing missed because medications do interact with each other and can cause, further issues. So having that information on hand is extremely important. Another thing is to ask questions. I know a lot of times it feels like, the doctor's in there 5-6 minutes and, you don't have time. They're running to see next patients, but it's very important that you ask questions.
Yes.
Questions of like, what are you prescribing me? Because I see a lot of patients, that are getting new medications and have no idea why they're taking them, how they're supposed to take them. So that's also an important fact to make sure that we're asking questions of our physicians and pharmacists, because pharmacists are your drug experts. So it's important that you ask any questions that you have. I wouldn't consider any question a dumb question when it comes to your healthcare. You would rather know than to not know. So asking questions and taking notes, because a lot of times once we're going through that visit, once we've left the pharmacy, once we've left the doctor's office, we may just happen to forget what it was that was talked about. So if you take notes and are able to recall the information from the notes that you've taken, that helps to alleviate those issues as well. So then also with those visits, I know it's kind of hard now during the pandemic, but bringing a trusted friend or family member to those visits can also help aid you in kind of remembering what was discussed during that visit. They can help recall, if the doctor did tell you what you're taking the medication for, if the doctor did tell you to stop taking certain medications. That's very important, like I said, to have that resource just if needed. If you find yourself kind of forgetting things and not being able to recall what was discussed, taking notes, having that trusted friend or family member there with you can always help as well. And we talked about, like I said, asking those questions. So if your doctor is prescribing medications and it may be something that he's starting and decided to stop on something else, that's very important to note in your medication list and to also tell the pharmacy, because doctors don't always relay that information to us. So having that list, like I said, also if you have it written, jot it down, you can cross out what they told you to stop. And then we can see from there, when we ask you about it, yeah, my doctor said stop that. He's replacing it with this. They've changed my dose from my, the workout has been helping. So they've brought my blood pressure medication down, to a lower dose. Just having that information is very important. But then with that, I'm sorry?
That's a good point.
Yeah, but
there are a lot of times there are changes.
Absolutely. There are a lot of times we have patients that'll come pick up a 90-day prescription for one medication, and then the next week after their labs come back, it's a whole different dose. So that's something that happens, that occurs a lot. And then it's very important to, speaking on those visits and things, to not stop medications abruptly, because that can cause a sort of a shock to the body. If you've been taking your blood pressure medication, but you feel better, you're not having as many headaches, things just feel better. It's very important to not ever abruptly stop medications, because that could trigger your body to have a negative response. And so we want to try to prevent those hospitalizations and things of that nature. So that's also very important, that we just, don't abruptly stop medications without speaking to a healthcare provider. Usually that healthcare provider needs to be the doctor that prescribed the medication. Because I get that question a lot. I've been feeling better. Can I just stop taking the medication? The doctor told me to take 2, but can I take 1? I can't tell you to change the medication from the way it was prescribed. But like I said, just having that relationship with your doctor. I know sometimes it's hard to get in contact with them. But using your My Chart, calling the office, speaking to nurses, they can at least leave a message with your doctor so they can get back to you. But that's just one thing I want to leave with you guys. Make sure we are not abruptly stopping medications, without first speaking to your healthcare provider.
Okay.
Let's see. Another tidbit of information is, for those patients that are taking a lot of different medications, or even if you're taking 1 or 2, using pill boxes is very important, because it helps to keep you organized. I have patients that are on 10, 12 different medications, that they take daily. And the pill boxes, range from just Sunday through Saturday to Sunday through Saturday 4 times a day. It'll have your morning, lunch, afternoon, and dinner doses that you can place the medications in there. And that helps so that we can stay adherent. And adherence is one of the most important things when taking medications, because if you're not taking the medication, you can't see the effects. Exactly. So I would say that's, using pill boxes is extremely important, or pill organizers. And some pharmacies actually offer services where they will take the medication that you normally have in the regular bottles and put them in divided doses for the day, so that you'll have that for, hey, Monday, these are all the medications I'll be taking. I'll take them out the pouch and take them. I know there's like Divvy Dose, Pill Pack, Simple Dose. Those options are very good for our older population that may just forget to take their medication, or forget what time of day they're supposed to take their medications. And so if you have that organized there for you, that kind of alleviates that issue of not having the medication at the right time of day. And that also goes into what we consider chronotherapeutics. Chrono meaning time, therapeutics is the medication. So with certain medications, there are times of day where it's most effective. So for like your blood pressure medications, some of those medications do come with, combination drugs. There may be a blood pressure medication and a diuretic or a water pill. So with those medications, if nobody's ever told you, I'm going to teach you something today. If you have a medication that is a diuretic, is a water pill, it should usually be taken in the morning, because you will be using the restroom throughout the day. And with our older generation, it's important that they not take those at night, because with getting up in the middle of the night, there's fall hazards, there are trip hazards and things like that. So that's why we want to make sure that you're taking those medications at the right time to get the desired effects. And then one of the other points I would make is about polypharmacy. Polypharmacy is defined as like getting prescriptions filled and dispensed at different pharmacies. Now, there are a lot of reasons why that happens. One being like inventory. One pharmacy may not have the medication that you need. So you have to take the prescription or get it transferred to another pharmacy. It could be cost, as I know that's a big hindrance a lot of times with patients. A lot of my patients are determining if I'm going to pay my bills this week, or if I'm going to get my medication. Yeah. So cost is a big factor sometimes. So polypharmacy could be dangerous though. Because once we're filling prescriptions, once the prescriptions are verified by our pharmacist, those drug interactions are usually checked at the same time. So for any medications that you may be on, your new prescriptions are checked against those medications to make sure that it won't cause you any of those issues from the interaction. So if you get them at different pharmacies, we have no way of checking if those medications will interact with each other. And also, like with those over-the-counter medications, you have to always add those to your medication list as well, because herbal medications, over-the-counter medications do also interact with prescribed medications. Right. So it's always very important that you let your doctor, let your pharmacist know any medication that you're taking, so that we can make sure that what you're going to be taking is as safe as possible. So that's why we kind of want to stay away from the polypharmacy, away from getting prescriptions filled at a lot of different pharmacies, because that kind of hinders our job to make sure that you're being safe.
I'm glad you brought that up. I think a lot of times we think polypharmacy is just having multiple drugs and not necessarily going to different pharmacies. So thank you for bringing that up. Is there anything else you wanted to share?
I think those are the main points for now.
Okay.
Questions?
Yeah, you got a few over here. So the first one is, what were your thoughts on Trump's hydrochloride solution for COVID-19?
It hadn't been studied, and widely studied. And those who did study didn't really see any significant clinical effects. So I tend to take my medical opinions from medical professionals. I'll just say it that way. So it's like I said, if it's not been studied, I wouldn't generally suggest just taking something just because you've heard that it may work. Because that medication itself could cause heart issues. So that's why, if you're just someone that is already dealing with something like AFib or, heart arrhythmias, that could cause you even more problems than COVID-19 in itself.
Right. For sure. So the next question is, what are your thoughts on marijuana as a solution to prescription?
I would say that, CBD is usually is beginning to pick up steam with for like pain treatment. There are some marijuana products that patients, like chronic cancer patients, do use to like increase appetite. Right. So there are some uses, some very good uses to marijuana products in the field of pharmacy. And like I said, there are going to need to be more studies on how it can or if it can necessarily replace some medications. But I mean, I just think it needs more study. I know like the CBD oils usually work really well for like pain patients, like some of our arthritis patients. Right. And they've shown that it works, really well for them. So I'm down for the alternatives and things that may work better for you than prescribed medications.
Right. And those CBD oils, like the topical ones, I know I've had some patients who use those, and they do get very good results in pain relief.
Right.
I would just caution people, and you let me know your thoughts, though, on combining different methods of, say, for pain relief. Because there are a lot of times that people will take the advice of a physical therapist and using methods that we use, like ice or heat, or even in positioning with different ways that you can align your body to not have the pain. But also they'll take a pain pill before they see us, and then they'll take a pain pill after. So how do you know which is most effective? So in my view, I tend to tell people you need to use one thing to see which thing is actually having the most benefit. But what are your thoughts?
I believe the same thing. If you're piling everything on at one time, you have no idea what's actually working, and you could be actually setting yourself up for further damage. Because, like you said, if your physical therapist is using heat sources or is instructing you to use heat sources, but you've also gotten a prescription for a pain patch from your doctor, applying that heat to the patch could deliver more medication than you're supposed to have. It can cause an actual overdose. Right. So those are the things that, you have to be completely honest, no matter what's going on. You have to be completely honest with all the doctors that you see. Mm-hmm. Nobody cares if, just randomly, I was smoking because whatever. Just let people know, because even cigarette use can cause some medications to not work properly. Right. Your diet could cause medications to not work properly. Like if you're a grapefruit lover, but you have high cholesterol, you can't take those statins with and eat grapefruit juice at the same time, because those do interact. So that's why you have to be completely honest with any healthcare professional that you encounter about anything that you're using, anything that you've tried, because those compounded effects could be dangerous.
Right, and we definitely don't want to do any harm to you or to ourselves. So we definitely need that honesty. So here's another question. Why do doctors always go straight to prescriptions for ailments? Is it always about the money?
I believe it's the severity of the case. If your blood pressure is just slightly elevated, lifestyle changes can help. If your blood pressure is stroke level, it may be too late for lifestyle choices. So that's
You get
where
a
medication.
combination, right?
Yeah, you can always combine the two. But something more like prescribed medications may be needed at the time to get you where you need to be, so that those other alternatives can definitely work for you. Now, I'm definitely a proponent of trying everything natural, or seeing your physical therapist, or anybody else in your healthcare team that will help, and so that you don't have to take the medications, because with medications, all medications have side effects. And so if you can do those things that need to be done to refrain from taking the medication, to even not even have to encounter the side effects, let's do that. But like I said, a holistic approach is definitely needed from your healthcare team. So straight to prescriptions, it depends on the severity of the case, in my opinion.
I like that answer. Okay, next question. Are you giving COVID-19 shots at your location?
We currently do not have the vaccine at our location. I believe it is planned for most locations to get it at some point. I don't know exactly when that is. We get that phone call daily. Do you have the shot? Let me get my shot. Why are you keeping me from my shot? So because we want to have as many people vaccinated as possible.
Right.
If we want to return to any kind of sort of normalcy, we have to get those vaccinations, and we have to kind of, from the medical field, we have to understand where the drawback comes from, and help to educate patients on the benefits of the vaccine. Like I said, vaccine still is a medication, so you may have side effects. But if those side effects, if the reward outweighs the risk, I'm definitely going to always, go for that therapy.
Okay. I don't see any other questions, but I think this has been good. I do have a question. I have some patients who tend to say that, oh, I'm getting so many prescriptions from my doctor. If I just take this one here and I take that one here, maybe I don't have to take them all on the same day, so that I space them out. They last the whole month.
Right.
I know you touched on it a little bit earlier, but maybe you should reiterate.
It's very important to, like I said, always take medications as they're prescribed. Like I said, when we get those questions in the pharmacy of, like I said, I'm feeling better. Can I stop the medications? Can I just take one a day instead of the two a day? My doctor told me to take.
Mm-hmm.
You have to think about it this way. Maybe you're feeling better because you've been taking the medication. Maybe the medication is causing those headaches to go away. It's causing you to feel better. So you have to think about the source of that help, that aid.
Right.
So it's always important to contact your healthcare provider before stopping or trying to change any medications. Some medications, if you're seeing that you're, like, even some pain medications, if you're seeing that you're having to take more because it's not doing the job, that's a conversation you absolutely should have with your doctor, because if that therapy is not treating the issue, that therapy needs to be changed. But that's not for something for us to take on ourselves, for me to say, hey, well, it didn't work that well, so I'm just going to take 2 or 3 more.
Right. That's out of my scope of practice.
Right, that's way out of my scope. I can't tell you to do that. I can only tell you to take it the way your doctor sent it over to us. So that's, you have to be, like I said, still have to be open and honest with your physicians, and let them know what's going on, let them know what's working, what's not working. If you're experiencing side effects, that's still a conversation to have with your doctor. Hey, this is working, but it's making me feel bad, so I'm not wanting to actually take the medication. So maybe there's something in the same class. Maybe there's an alternative that could be prescribed and could be used that may not give you those same side effects, but still give you the desired, effects.
For sure. Okay, here's another question. Which vaccine do you think is more effective, the Moderna or the Pfizer?
I don't know that one is more effective than the other. I have had just, anecdotally, seems that people that got the Moderna vaccine experienced some, more side effects than Pfizer. But like I said again, if the reward outweighs the risk of those side effects of, feeling like you're coming down with a bug, you might, get a little fever. I would say still take it. And so, like I said, I just don't really know that one is more effective. I think through the trials that came out at the same percentage of efficacy. So I don't really, like I said, know which one is better than the other. I would just say do the research, even if that's, talking to friends that have had it, just checking online to see who has given reports of the vaccines that they received and the experiences they've had. But just have to always remember that each person is different. So you may not get the same effect, or you may not have the same effect from the vaccine as others did.
That's true. All right. Do you have any thoughts on homeopathic medicine for the elderly?
Again, I just think that it depends on what it is. It depends on what it is. It depends on what you're trying to treat. There are some homeopathic physicians that mainly deal in natural medicine. And so those are probably going to be your best bet to get that information from. There are always natural products, OTC products that you can use. Sometimes in combination with prescribed medications, but again, it always goes back to checking with your doctor, checking with your pharmacist before you start taking those medications, because they can interact. But I am a proponent of, like I said, alternative medication, homeopathic medication, when it comes to, treating those disease states. Whatever works, let's make it work and get those desired effects. But like I said, we just have to be smart in our approaches. You have to take advice from people that have done the work, have put in the hours, have taken the classes, have passed those board exams. You have to, like Ms. Beasley said, you have to follow the research. So you have to follow those that have the correct answers. Anytime that you're trying something new.
Right. So don't use your Google search as your only method of education, right?
Right. Your Google search can lead you on can start the journey, but then, like I said, have those conversations with your doctor. Hey, I saw that so-and-so can work. What do you think about if we added that to, my therapies?
Right. And so as a final point, a lot of times with older adults, we tend to think that our doctors are kind of superior in terms of what they prescribe. But it's always best, like you said, to ask questions and to be very sure of what you're being told, so that when you get home, you can actually use what you've been told and it'll give you some effective treatment. A lot of times we tend to think that what physician says is the gospel, and we don't challenge it. And it's not that you are challenging it to be negative, but just as a matter of clarifying it in your own mind.
Right, and I believe in that regard, it's all about your approach as well. You can't tell your doctor, I'm not taking this because you don't know what you're talking about. It's all about your approach. Well, when I was in the pharmacy, my pharmacist said X, Y, and Z. They recommended, X, Y, and Z. What do you think about it, or how do you think that could affect, where we are right now? So I definitely think that is important. That you, like I said, ask the questions, be intentional, but you can't be disrespectful. So that's just important, like I said, to make sure those things are done. So because it's all about the benefit of the person, of the body, of your health. We're all here to make sure that you actually feel better.
Right.
It's that's our job. That's the oath we took, that we do no harm, and to make sure that you're being as healthy as possible, because there's nothing like being able to see somebody say, hey, come back to the pharmacy. Hey, I started working out, started eating better, no longer taking these medications. That's a win. We want to see everybody win. So if that's something that you can, that's extra money in your pockets, so that you're not coming to the pharmacy or you're not having to go to your doctor, every month now or, things like that. So definitely think that's a win.
Yeah, and it's definitely possible to be an aging adult and not have to take any medication.
Absolutely.
It does not have to be the norm that as you age, you have to accumulate prescription drugs.
Right.
I do thank you so much for your time tonight. I appreciate all that you shared. If there are any final thoughts you want to give, please feel free.
Okay. Like I said, again, I do appreciate you having me here. So just to recap, like I said, we want to be intentional with our physician and pharmacy visits. We want to make sure that we're using pill organizers and those services that are provided, usually at no extra cost, to make sure that we're being adherent to our medications, make sure we're taking those medications so we get the desired effects. And finally, also to kind of limit as much as we can the polypharmacy so that those that are in charge of our medications or dispensing our medications have all of the necessary information to make the professional judgment we need to make on whether or not you should or should not be taking these medications.
I agree. Thank you so much for your time. Everybody, I hope you gained some wealth of knowledge from Dr. Harrison Beasley. Have a good evening.
Thank you so much.
You're welcome.